trying to tap into authentic Ghanaian music, eh? This was around 1984, George Dakun, the late George Dakun. But guess what? I get to kind of sample forward rockstar Kwame Eugene has a sample, a slice of this. Let's see if I can push that in there. I think that's back to 2025, huh?
I work every day.
Joy 99.7 FM.
So I want to party. So don't be lazy. Charlie, you must be happy. Enjoy the party. So the family champion. Assassin so na die be inside. Happy everything be na ever. Into empty. Oh, yeah, I'm at the impression.
Joy 99.7 FM. Joy 99.7 FM. Joy 99.7 FM. Joy 99.7 FM.
All right. I've done my Ghana stuff, but it's still time for Ultimate Health. I've got the guests from Platinum Orthodontics and Advanced Dentistry. Dr. Novishi Akutu, lead clinician and specialist orthodontist. Dr. Yao Asamoedu, principal dentist. We're looking at the link between oral health and mental health, and I'm a psychologist, and I guess there could be or should be some relationship. You're welcome.
Hi, thank you.
How are you doing?
We're good.
You're good?
Yeah.
I'm checking out your smiles, eh? Since you're dentists, maybe we should model our smiles on yours, right?
You wouldn't go far wrong.
Right.
Yeah.
Exactly. Salutes to Platinum. Last year we had you. I think last year was your 10th anniversary. Am I right?
Yes.
Yeah. You were celebrating, and you swore to light up Accra one smile at a time. Yeah, how did that go?
Well, it's been interesting. So, like you said, we started the celebrations last year. It's actually still ongoing.
Okay.
And so there were a series of activities that were planned, and we started last year with some screenings. We had 3 different screenings in different areas, and we're just trying to bring oral health awareness to the population in those areas. We also gave some healthcare tips. We also gave some things that people could use to maintain their oral health, and then we also gave some treatments as well. But that was just phase one. Phase two actually was picking 3 people who we decided we're going to treat pro bono and basically just help to transform their smiles. And actually, I find that it's interesting we have this theme this year, which is the happy mouth, the happy mind, because what you find is that as you take time to speak to your patients and to find out what their challenges are,
Okay.
those challenges are rarely just about their teeth. What you find is that there's an inextricable link between their teeth and how they feel about themselves and how they go about their lives. So we have 3 people who we are currently taking through a whole smile transformation process, and when the outcomes come, we'll share it with everybody to know how
Right.
that went. Yeah.
Okay, so 20th of March is World Oral Health Day,
Right.
and the theme extends. Last year was your smile,
Last year was
happy,
Happy
healthy mouth,
healthy mouth, healthy,
healthy
body.
body.
That's right.
So a healthy mouth is a healthy body.
Right.
I think that has been proved, and the association is huge. In fact, just very, very recently, 31st of January this year, there was a study that came out that said that even flossing your teeth once a week. Now, let's be clear, we want you to floss every day, but
Okay.
if you floss your teeth just once a week, you reduce your risk of getting a stroke. So all of the associations between what's going on in your mouth and your body has been totally and utterly captured. And that was last year, 2024's World Oral Health theme. And this year, we are looking at a healthy mouth is a healthy mind.
Right. Okay. Why should I mind you? What's the link? Healthy mouth, healthy mind. I mean, fine. I guess my appearance, the way I speak, and many other things, the condition of my teeth and all those things should bother me, right? But as soon as you bring mental health into it, and I like to make the distinction between mental illness and mental wellness or mental health. But let's go into that a bit, all right? So what we're suggesting underlying this theme is that there is a link, like you just said, between your mental wellness and your oral health.
Yes, again, there is a link, there is an association, and what a lot of the research is showing is that those who have the common psychological illnesses like anxiety, depression, etc.
yeah.
If you now start looking at their oral health, we have an index called the DMFT, so decayed, missing, and filled teeth. There's definitely an association that those suffering with even minor mental or psychological issues have an increased amount of decay, missing, and filled teeth.
Okay.
But we are also now getting into the time and the zone where we are looking at the overall definition by WHO for health, which is not just the absence of disease, but also making sure that the person can integrate socially and psychologically.
Right.
So the psychological impact of having anything from misaligned teeth to terribly colored teeth to embarrassment to halitosis all now start to play a part in how people perceive themselves and their overall health in terms of the psychological makeup.
Okay. If you just joined us, 15 minutes past your 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, I bring you the top-notch professionals, practitioners to explain, to break down the health information so that you can, be as active participant in your own health and well-being. We're discussing the link between oral health and mental health with our guests from Platinum Orthodontics and Advanced Dentistry. We're just getting to understand the link. But share with us, how do you feel about your own oral, situation or oral health status? If you have slightly discolored teeth, if you have a gap, if you have crooked teeth, misaligned teeth, and all that, how does that play into, your general self-esteem, social awareness, sensitivity, and all of those kinds of things? We'll be breaking some of them down so you can understand. WhatsApp is 055 11 11 997. We're live on Facebook YouTube and X. So very shortly also I will activate the phone lines. Now, yeah, coming back to this whole theme and understanding it, are we suggesting therefore that, you, my partners in the field of dentistry, should be concerned, should be looking out for, should be screening some of your clients who present to you for various reasons? Should you also be checking if they have any of these mental health concerns before we break it down to specific presentations? Is it the case that, well, I'm having a filling done, but you're checking if I'm okay, if I'm anxious about those kinds of things that we just heard from Dr. Akutu?
Exactly, Nortey, because what you find is, for most people who come into the clinic, you are rarely, and I mean you are rarely just dealing with the teeth. Often you are dealing with the teeth.
Okay.
You are dealing with the individual. You are dealing with their pre-existing thoughts or feelings about dentistry. So you have patients who come in, and just by seeing the way they walk into your operating room or your surgery, you can tell they're anxious. You have a conversation with some of them, and you can tell that even though they are presenting with concerns about their teeth, really they are presenting with concerns about how the state of their teeth is affecting their everyday lives.
Right.
So there is really that link, and as part of your history taking process, as you engage with a patient, one of the key things you are looking for is what is the psychological state of your patient.
Okay.
Because you cannot treat your patient effectively if you do not consider these aspects, because then you are probably just treating the patient halfway. So yes, you're going to do your filling, you're going to do your clean, you're going to do whatever you're going to do, but you have to figure out if this is really solving the problem of your patient.
Okay.
Because if you can't determine that from the start, then you are possibly heading on the wrong tangent when it comes to your healthcare.
Okay,
treatment.
so that passes the baton in many ways to you, but not fully.
Yeah.
Right? If you do find something, then there are ways of referring and making sure that that is properly addressed within the mental health domain.
Exactly.
Okay. So Dr. Akutu, let me ask. So I've come in for a filling. I've come in for a clean. Is that what you guys call it? Clean.
Yeah, that's very
Cleaning, right, of my teeth. I'm worried whether my teeth are white or they should be white, and if they are not, why not? Don't you just get down to business? But this, from Dr. Asamoah's response suggests that there's some interview and there's some history taken that may suggest some of these things may be underlying my presentation for that treatment.
Yes, I think that as clinicians, we have to get out of the mindset of just treating what we see and stepping back to actually look at what the causative things are. So somebody coming in for just a filling, or they all of a sudden cracked, a tooth or multiple teeth, we are looking at literally how they are walking into the operatory. We are looking at how they are interacting with us.
Okay.
There are definitely questions that we are going to try and answer, and we're looking at habits, and it can be minor habits like, do you bite your nails?
Right.
Are you aware of any clenching or grinding, especially nocturnally and at night? And if we look at somebody who is anxious and their whole persona is that of anxiety, even before we look in the mouth, we know what we are going to see.
Okay.
We are going to find that this person usually actually clenches a lot. So even from the face, the muscles that are responsible for clenching are going to be overdeveloped. By the time we look in and we're looking at just the soft tissues, we can usually see lines where the teeth meet together.
Just because I clench my teeth?
Yes, just from the actual persona
Right.
and the clenching. And, we call that linea alba, and there are white lines that are on the inside of their cheeks. And then when we take a look at their teeth, and now we do a lot of scans, we can see where they are now wearing their teeth. Because when you are relaxed and at rest, there should be a 2 millimeter gap in between your teeth. But anxious individuals tend to keep their teeth together, and especially at night, either clench repeatedly or
Right.
grind.
Or they
So they
grind.
are overusing their teeth. Now, this actually has a cyclic effect, because the clenching means that they are working muscles
Okay.
So they usually wake up with very, very stiff jaws. They have a lot of headaches. And all of these things we need to pick up and actually address, because doing the clean and the filling is not going to address those issues.
Okay.
And what's most likely to happen is that they'll return with other pains and also
Joy
more broken teeth.
99.7 FM.
So we are really, really looking at what's causing what we're actually seeing, and looking at the patient holistically rather than just from a clean filling point of view.
Wow. As you listen to us, do you clench your teeth? Are you in the process misaligning something? My docs in the studio are suggesting that over time, once these patterns of behavior are present, they already have an anticipated profile, things they are looking for, and things they may find in your oral cavity, right? And these are related to many conditions. Of course, those conditions are physical, but we're looking at the mental or psychological correlates of these things, and they tell us a lot about your health and your well-being. The theme, happy mouth, happy mind, now is kind of hitting home. I'm starting to smile a bit. I'm not there yet because I still have some worries. If you have any, share them with us. WhatsApp 055 11 11 997. Shortly I'll activate the phone lines. We're on Facebook, YouTube and X. This is Ultimate Health, your ultimate guide to healthy living on Joy 99.7 FM. So coming back to this, so already just even my body language may suggest to you that there are issues. Do I look tense? Am I anxious? Does this should I say even shift across situations from waking consciousness to sleep?
Yes, and I think that that's another really important thing. I jokingly say that I'm yet to meet many CEOs in Ghana who are not clenching excessively. And this actually affects the quality of sleep. And we all know how important sleep is in our ability to cope with the day, to be more tolerant, and to live an actual full life. And so many of the CEOs, one of the things that they do...
Hang on. You're a CEO.
Oh, yes. And I clench.
You clench it.
I clench my
There you
teeth.
go. So now I have a case study.
Yes.
Right? So is it tension over work? Is it what? And it's translating into physical, somatic
Yes,
presentations.
it's basically stress. And I think that there's another very interesting study, and they looked at the effects of COVID, where people were significantly stressed, and what happened to their actual teeth. And, it's night and day.
Wow.
And even if we're talking personally, just from clenching and being stressed during COVID, I actually fractured a major tooth. But what we are finding is that once we correct that, or once we make the person aware, then there's something very simple to do, and this can transform the way that they are sleeping.
Okay.
They get a better quality of sleep, and then this actually translates to other areas of their life. The other thing, though, is the number of CEOs and business owners who fall asleep when they are having dental work done. And we love the fact that you trust us, but we're like, wow, with a drill in your mouth and all of the noise, they are gone in like 3 minutes.
That is without any gas,
without
Without
any gas.
They zonked out.
They zonk out.
Now I zonk out when I'm in the barber's chair, and you say, "Boss, today you tired, pie." But is that not just tiredness? But you are relating it to actual presentations and things that you may observe.
Well, you realize that sometimes it's just the fact that this individual has probably not had a good night's sleep.
Okay.
And so just having a period of time, because what we try to do as part of our practice is we want to try and create an ambience in the dental surgery where it's relaxing, so we are not using any other adjuncts, any drug
Okay.
adjuncts, just creating an ambience. And you realize that once they find themselves in a state
You relax your
of
clients
relaxation,
naturally.
yeah,
Okay.
they just sleep, because it's quite possible that over the night they haven't had much sleep. They've been
Right.
stressing about one
Your
issue
place
or
must
the
be
other.
really comfortable.
Well, yeah.
We try.
All right.
Yeah.
Okay. So this linkage, and Novishi, you've kindly shared, some, research evidence that supports some of this. It's not that we're mucking around, we're joking, right? So stress can actually reflect in your oral health.
Oh, significantly.
Right.
It can affect your actual facial, appearance.
Mm-hmm.
We now are fully aware of the facial, aesthetic, realm, and the number of women in particular who literally feel as though they have overdeveloped masseteric muscles, which makes their jaws look very, very square, and that they actually don't like. But then again, what's actually causing that?
Okay.
It's overuse of the muscles. And so you are basically looking at
These
all
are
of
women
those.
who previously did not have those square line jaws.
Exactly.
They have actually acquired or developed this over time.
Over time, just like, because these are muscles. So if you overwork them, it's exactly the same as going to the gym. They will grow in actual stature. So now, we would use Botox separately, not from an anti-wrinkle point of view, but from a relaxation point of view, to
Okay.
relax those muscles
Right.
over time.
Okay.
The other thing with the jaw problems is that this is where we now start to cross over, because some of the times we now medicate the patients at very, very low level, but with amitriptyline and other medications
Okay.
that are used in much higher doses to deal with anxiety, depression,
Right.
obsessive compulsive disorders,
Okay.
etc.
All right, this is getting interesting. I'm scared to squeeze my face because they might diagnose something. Ultimate Health on Joy 99.7 FM. On the heels of World Oral Health Day, we're looking alongside the theme, yes, at the linkage, the relationship between your oral health and well-being and your mental health and well-being. And we're learning that are, clear links, some of which are established scientifically. If you have any questions, concerns, WhatsApp 055 1111 997, and shortly I will activate the phone lines. Okay, so you've already tiptoed into certain presentations already. But for many people, when it comes to maybe even attempting any understanding of this linkage, they would want to talk about bad breath, right? Halitosis. Okay. Now, I can understand how this can be embarrassing. Okay, and I tell people anxiety is not a disease unless it crosses certain lines. Okay, shyness is not a disease. It's a defense mechanism. It's supposed to keep us in check and protect us, right? But at what point do you get these kinds of presentations with bad breath or halitosis that strongly establish this linkage?
Well, so what I've found, and this is probably, I feel like, in your practice as a clinician, you have these landmark moments.
Okay.
And I had this landmark moment really early, still in my training years. And it was of this man who worked in the same hospital as I did at the time,
Okay.
in a different department. And I remember he came by because his wife had complained severally to him that she felt he had bad breath. And because of that, for the period of about 3 or so years, they had no intimacy relations. And so he came to me, obviously quite
She'd
embarrassed.
actually given them a red card.
Yeah, for 3 years.
Okay.
And so he came to me with this. So obviously, as a man, you feel embarrassed by the situation. You're having to deal with this situation of not being intimate with your partner
Okay.
and just not finding a solution. So he came, we had a whole consultation. And I remember very clearly that during that consultation, it had very little to do with the teeth itself. It was, how do we get him to the point where he feels confident enough
Right.
after the treatment to even approach his wife again and to try to initiate any kind of
Right.
relation. So it's very interesting because that for me squared very clearly the fact that I am not just dealing with teeth when I'm dealing with patients.
Okay.
And so you talk about bad breath, and that was a very clear example. So we had to take him through a whole protocol, like you said, cleanings and how to maintain oral hygiene and everything. And by the end, his whole persona changed.
Right. But let me ask you this, Yang. So let's say, for example, his wife hadn't even been courageous enough to tell him, but he himself had a sense or some subjective awareness or anxiety about his breath.
Right.
that would also be sufficient to start causing these problems.
Oh yes, significant, because a lot of the time, and this is so when it comes to halitosis in particular, when people come by the clinic, a lot of the time you have to figure out what kind of halitosis are they dealing with.
Okay.
And there are times where you find that I'm very careful, because you don't want to tell a patient it's all in your mind, but
Okay.
sometimes it's all in the
So
mind.
what you're trying to say, that there's psychogenic
Exactly.
halitosis or
Yeah.
pseudo-halitosis.
Pseudo-halitosis.
So I feel
Yes.
I have bad breath.
Yeah.
And you're trying to say that there are situations where people come to you, right, on account of bad breath,
Yes.
and you are able to establish that it actually isn't there.
Yes, objectively it's not present, clinically not detectable,
Right.
but the individual believes
They
it. And
still have the belief.
yes, and it becomes dangerous because all the compensatory activities that you would undertake or do to try to improve this or to try to hide this
Right.
can actually lead to bad breath.
Okay.
So for instance, a lot of people would then avoid speaking often
Right.
because they don't want to offend the people around them with their
Okay.
believed bad breath. But what that means is that you build up the noxious gases in your mouth so that when you do speak, you do have some level of
So
bad
by
breath.
keeping my mouth shut, I'm actually worsening or increasing the probability that there will be a buildup of gases that, as
Precisely.
Ghanaians would say, can be heard. Right.
Precisely.
Okay. So I understand, and I, alongside you and some reading, that you can grade halitosis, right?
Yes.
From non-detectable, blah blah blah, all the way. So you're saying that this person doesn't have it,
Yeah.
but the mental health issues associated or secondary to this whole problem
Yes.
can actually worsen the situation.
Precisely.
Right.
Precisely. So it then drives home. So there have been cases where, and Dr. Akutu, we would literally look at the patient, discuss, and say, you know what, this isn't purely a dental issue. We
Okay.
have to make a referral to a qualified clinician to
Right.
deal with this, because this is more than just bad breath. There might be something else going on in this individual's life
Okay.
that requires more qualified attention. So
Right.
yes.
Okay.
Yeah.
And this is why, folks, listening to us, sometimes you find us alongside these actual physical presentations, clinical physical presentations, there are underlying and related secondary or associated psychological and psychiatric disorders. Some are depressed
Yeah.
on account of this. I've handled a case where somebody was totally suicidal on account of bad breath.
Wow.
Right, and so apart from my guests or their colleagues handling whatever issue there may be orally in terms of his oral health, there's a big issue, maybe secondary or even primary to that,
Yeah.
that needs to be looked at. So that's what we're looking at, the link between your oral health and your mental health under the theme Happy Mouth, Happy Mind. Let me activate the phone line 0302-216-541, 0302-216-541. WhatsApp is still 055-1111-997. I saw something. Afenya says, okay, she's giving me her favorite song by Alex Owusu. She loves it when I bash her. I've seen her dancing before. Why? Good afternoon, Nortey. I can identify, where is it now? I can relate to this topic. I have serious dental issues. I have halitosis, and because of this, I don't have the confidence in myself, and I have rejected a lot of positions at church that I know I'm very well competent to handle. Please, any help? I've lost confidence in myself. This is from Seth. Any quick responses to that?
Come and see us, Seth. We will look after you and help you along your journey to recovery.
We will look after you and help you along your journey. I like the fact that you bring in journey, right? Many people who are so troubled, especially if it's tiptoed into their mental wellness or mental well-being, Charlie, they want they want straight away, click, 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 done, right? And go calm. Reviews and all those bother them, but she says, hey, they will help you with that journey, right, Seth? And I'm sure I'll get in touch with you. My producer normally patches through all these messages and the contacts as well. So that's halitosis, right? And we can conclusively should I say diagnose this.
Yes.
Yeah. So if it's not there, we have a duty also to now convince the person who is convinced in the other direction, that it's not there.
Yes.
Precisely.
Okay, that's a job.
Yes, and that's when we refer to people like you and get the clinical psychologists in.
Right.
The difficulty, though, is that sometimes culturally people do not want to go and see psychologists.
Right.
And with the availability of information on the internet, they just keep pursuing one thing after the other, and self-medicating in effect
Right.
to try and overcome it, which causes its own effect. So they do get stuck in this cycle,
Okay.
which can be quite difficult to break.
Okay.
Yeah. But from there, you then have the opposite, where you have a disease or a condition like trigeminal neuralgia, also previously known as the suicide disease,
Right.
where there is an actual definitive cause. It's there, and the intensity and the sharpness of the pain, which usually presents in the face and or the teeth, is now driving them to become extremely depressed, anxious, scared of the actual attack, to even contemplating suicide.
Okay, hang on a sec, right? All that is a mouthful. It's a mouthful, right? You gave the diagnostic name, right? You're referring to pain.
Yeah.
Is it facial pain? What? Let's break it down a bit, and then
Yes.
my listeners can chew with you.
Yeah. So it is
No, give the name again.
trigeminal neuralgia,
Okay.
but in its most basic definition, you are thinking of a pain which is felt in the craniofacial area in the face,
All right.
head, neck area, and it's usually sharp, very debilitating, very severe.
Okay. So where about would I be feeling or experiencing this pain?
Well,
So you could be just getting along with your business, then all of a sudden you feel a stabbing, searing pain.
Okay.
Most people will rate it on a pain score 12 out of 10.
Okay.
It can be in your cheek area. You will be convinced that it's a particular tooth.
Okay.
We will look at the tooth. We can't see anything wrong with the tooth. You will literally beg us to take the tooth out because you are even scared about the thought of that pain returning.
Okay.
And what usually...
And this is real.
And this is
Yeah.
real.
This is not a delusion.
no.
No.
Right. You're not hallucinating or anything like that. It's real.
Yes.
It's there.
Yes.
Okay. Now continue.
And what tends to happen, because there's now the fear of the pain, because you don't know when it's actually going to come.
Okay.
It can go away for like a week, then you can have multiple, episodes. And the general and the characteristic, presentation, if it's affecting the mouth, is that they'll convince you to take a tooth out, even though then they are convinced it's that tooth. You take the tooth out, 2 to 3 months later, they come back, is the tooth next door. No, I'm 100% sure. And this can actually continue. And what it is that it's the nerves that are actually triggering,
Okay.
and you read about it, etc. And a bit like Yao, I was very, very fortunate actually in my second year in Ghana to be discussing a patient that I was sure had it just by the presentation.
Okay.
And she got up to leave at the end of the consult and then had one of those episodes.
Right there on the premises.
Right there, literally getting to her knees in total and utter pain. And with this, obviously, then there are only two ways of dealing with it: either to medicate or some form of surgery, because it is a nerve that is firing spontaneously.
Okay. Wow. 40 minutes already past the hour too. We've only just covered some kinds of present, but I guess by now you are getting the linkage, right? Anything can be happening with or around or in your oral cavity and the related structures, and that can affect your mental well-being and vice versa. That's what we're looking at with the guests from Platinum Orthodontics and Advanced Dentistry. They're in the airport. Is it Airport Hills? Finale Drive, right?
Yes.
The way you've mentioned CEOs and things, I guess my guess would be afraid if they are not CEOs to come to you. They probably think you see only CEOs. I know they don't. We've had some of our listeners last year. Was it Henrietta? And I've forgotten the other names. I'll get them in a sec. But they came for a clean.
Yes,
I actually have videos of them. They loved Platinum, right? I think
I loved having them as well.
I think I've seen. Right, Henrietta is typing. Oh, good. My mother's namesake. She has my mother's name as well. She says, "Good afternoon, Nortey. There's a male." Oops. Yeah, she said, "There's a male teacher in my school who has halitosis. I can't tell him, but I'm close to him." Right? Right. Close to him meaning that you have a good, close relationship. Close to him also means that physically and work-wise you are close to him. But somebody sent me this just early in this week. I put up some teasers about this program. And somebody responded and wanted to know how to tell somebody who's close to you. Okay, I gave them a few hints, but this is Henrietta's problem. Okay, she senses it. Okay, that's not a diagnosis, but that's a discomfort from her. And how do you deal with this? And how should she help somebody come to professionals like you?
I think that
I cleverly passed it on to you.
yes, I think that you started with the phrase "I am close to the person."
Yeah.
So it's part of your duty in maintaining that closeness that there are certain conversations that may be difficult, but you know are going to benefit the person in the long term.
Right.
So it's one of these things where you do have to have the conversation or at least suggest it, and you do need to then ensure that they have accepted it and are actually going to do something about it. You can't force anybody to like do something, but one of the things that also happens is that practices do have gift vouchers, and so you do find that people will buy a gift voucher
Right.
and give it to the person.
Are you giving us some?
And and then inform us that that's what they are, actually concerned about.
Okay.
But then help them, because this could change their lives. And if you have realized it, you are not the only person who has realized
And exactly from the link we're explaining to you as listeners and viewers, you know what? This also may indicate that underneath the skin, that person, that teacher you're talking about, is suffering mentally, right? And because it hasn't been broached or addressed, they're nowhere near getting a solution.
Yeah.
Okay, so Henrietta, we have your contact. We'll see what we can do in there, right? But true friends care, and they also dare. So sometimes you have to have the courage to, if you're looking tatty or there's something wrong with you, I have to tell you, okay? And if truth will separate us, then the union itself, but I understand what you shared and grateful you shared it. Okay, so people have misaligned teeth, discolored teeth, and all of these things, right? Do these also present with the associated or related mental health issues and concerns?
Huge. And if we're looking at misaligned teeth in particular, we definitely know that other than people's ears, teeth are the next thing that children bully about.
Okay.
So on the playground, if somebody's going to be bullied, and we're talking about their physical appearance.
Kids can be mean when they want to.
They can be extremely mean. It's going to be the ears, and after ears, it's always going to be about their teeth. And obviously, if somebody's being put down about something over and over and over again, then the very interesting thing is that the bullying and now their perception of themselves, especially at a young age, feeds into how confident they actually are, how outward they are, how much participation they're actually going to give in class, etc. And now you are ended up creating a problem. Now, what we do have to say is that kids are also quite perceptive. So sometimes it's the demeanor of the person, and then they've just picked a physical attribute to attach to that. But a lot of the time, we do have to admit that it is the people whose teeth are sticking out, etc.
Okay.
And in that case, there is an actual cause, and that can be dealt with extremely quickly.
All right.
Actually, independent of age. So, although when we are talking about aligning teeth, there are preferred ages, bullying and harassment or somebody losing confidence is one of the known cases where we would actually treat as early as 5, 6, 7,
Right.
just to correct that actual feature.
Okay.
To remove the physicality of where the bullying is being pointed at,
Okay.
and then obviously help them through that
Right.
before everything is actually set.
Should we jumping in there, right in there? Should we be screening children, and should parents be concerned if they notice any features about their children's oral structures or dentition and all that? Should they, to prevent the build-up of this secondary emotional and other things, get this addressed early for their children?
Absolutely. I think, it's funny because we had a clinical meeting just yesterday, and we were discussing that, we really should be, because what you find often is you have patients, I see mostly older patients,
Okay.
and you find that when they come in at ages, maybe mid-30s, early 40s, sometimes in the 50s, you realize as you talk with them that they've always had these concerns about their teeth.
There's already laid down history.
Exactly.
Right.
But they never had the chance or they never had the confidence to have them addressed.
Okay.
And so when they are older, perhaps at that point they are still a bit self-conscious, and so they would like to have them addressed, but even to broach the conversation
Right.
requires some level of...
So these fears, anxieties, concerns are deep-rooted firmly now.
Yes.
Right? And part of the person.
Yes.
If they present at a later age.
Precisely.
Right? So what Dr. Akutu was talking about is, of course, children. Right? So my teeth are this or that, crooked or this and that. We have awful tree and gun names for them. I'm not going to go into that. Okay. But yeah, people have teased you about it over time. All right. Even in politics, we're hearing people being told they have sharp teeth and all that. Okay. Whether it's actually verified or not. But it's not a pleasant thing to encounter or experience.
Yes.
And we're saying that over time, this causes the related secondary or whether it's even primary concerns with their mental health.
Precisely.
Okay. And this is especially sad if we know that there are interventions that work, that correct and help these people with, issues they didn't go and buy in a shop. They didn't choose to have teeth like this or like that. So we should be looking at this early. And what you're suggesting is that if you present later, it's likely that over time you've built up the mental health issues and burdens already, and they become part of you.
Yes.
And your social, should I say, profile as well.
So it's quite interesting when we ask an adult to smile. And you find that especially in this social media world that we live in, and being an orthodontist, they have come to me because there's a problem with the alignment of their teeth and their bite. And you ask them to smile, and a lot of adults have what we term a Sunday smile, where they have learned how to smile to minimize the exposure of their teeth. You have those who automatically will cover.
You mean they're smiling in restrained mode?
Extremely
The same
restrained.
way some of us chew in restrained mode. We don't
Precisely.
chew on certain sides of our mouth, right?
Exactly.
So you've learned to smile.
Yes, you
Wow.
know, or automatically the hand comes up to cover the mouth, or the hair is swished so that in the smile the hair covers the mouth, etc. And again, we actually note and document all of this because what we need to do during the course of the treatment is to really ensure that we are rebuilding confidence.
Right.
And so it's not a matter of start and then finish. You know, we are all into the befores and after, but the during is also really, really important.
Right.
So they may come in and we'll all of a sudden say smile, and we are noticing whether there's now a change in how they are smiling, whether it's more spontaneous,
Right.
whether it's not forced. And again, all of this starts to build into confidence.
Okay, we're talking about the mind, but last year we did the body. They are related. Mind and body are one, okay? But there's body dysmorphia, right? And there's a related, presentation or association in dental, the dental spectrum, right? There are people who have concerns, like you're saying, about their smile or the way their teeth look and so on and so forth. And these, if they do exist, right, are also a problem.
Yes, they do. They are, because, you see, as a clinician, you have to be keenly aware of when the problem you are treating isn't organic.
Okay.
And so when you are seeing a patient, so I have a patient who comes in and says, "Oh, Dr. Yao, I think my teeth are not white enough." And I think I've said on this show before that the teeth aren't technically supposed to be white.
Which was a relief for a lot of listeners. Let's say, hey, hallelujah. Right.
But that's what they believe. And again, like Dr. Akutu mentioned, you go on social media, you see influencers who have pearl white teeth, and you think, oh no, they have what I want. And so you are holding yourself to an unreal standard.
Okay.
And you're doing things that are actually unhealthy. So I had a patient just this week tell me that she's been using baking soda with hydrogen peroxide to brush her teeth.
Let me clear my throat. All right. So she's looking for the whiteness.
Precisely.
Okay. Right.
And now she's coming to me with pain and sensitivity as a result of this, because this has been going on for a while. So you realize that there's this element of trying to achieve a standard, because a lot of, like what you said earlier, body
So you believe
dysmorphia,
something is wrong.
there is, yes, and they think that wherever they are at that point isn't where they should be. So there's an ideal that you're aiming for, which is unrealistic.
Wow.
But
Okay.
you're shooting for that.
So they start patronizing all sorts of interventions and products which they shouldn't be using, right? And they are perhaps seeing the wrong people, right? Who would not identify this, condition, right? And then start moving them towards the right treatments and the right alignment, if I can use that, for their mental health issues as well. This is interesting, right? I came across, what was it? Philematophobia, fear of kissing. Mwah. Right, that's a peck. Okay, but it can get very more skilled than that. But what is fear of kissing, and are you guys bothered about it?
I can honestly say that in 20 years of practice, it's probably come up about 3 or 4 times.
Okay.
And that fear usually is due to halitosis, which we have already covered, or due to teeth that are missing. So missing teeth causes a lot of anxiety and concerns, and then shaken teeth as well. But again, a lot of the time, it's based on what the person is thinking is going to happen, or what the person feels that the person who they are kissing is going to be looking at or feeling. So they are in effect manifesting something through their mind,
Okay.
and then over-regulating how the other person may receive their kiss.
So is it my baby or your baby?
I think it's both our babies.
Right.
Because if there is a genuine cause, then we need to address that.
Okay.
But then we then pass it on to you to look at the psychological undercurrents that are
Okay.
ongoing.
All right. Please, my daughter sometimes grinds her teeth in the night while sleeping. Is it a sickness? This is from AT.
So I would have loved if she had indicated the age, because we do know that children at a certain age grind their teeth, but there are many other causes, from sometimes being hungry to having food in the mouth. So if we knew the age, that would have been useful. But we always say that it's good when you have a concern about your child, it's always good just to have
Have it checked out.
a clinical opinion.
All right. Okay.
Worst case scenario, child gets treated. Best case scenario, there's nothing to worry about.
Okay.
So,
If it's not there, you'll be told it's not there, right? If it's there, it must be captured, confirmed, diagnosed, and then the appropriate intervention or treatment is undertaken. All right. This one says, good afternoon. Having done S&P severally, yet no improvement in the halitosis, what are the other causes of halitosis apart from dental issues? Is there any truth that halitosis can come from the stomach or the head? Right. I try to, save that for bringing them in another time. But hey, let's take a stab at that.
Yes, so there are several causes of halitosis. We talk about the local causes.
What's the person referring to? S&P? Yes.
So that's scaling and polishing, aka cleaning.
Okay.
Yeah. So the local causes of halitosis, that's the things that are happening in the mouth that can cause halitosis. So presence of decay,
local
gum disease.
Being those located in the oral cavity.
In the oral cavity.
Great.
And then because you have this continuation with the GI, the gastrointestinal tract, you can actually have some causes of halitosis that come from the stomach.
All right.
And so yes, there can be that,
Okay.
but it has to be diagnosed properly. And then when they say the head, what they really mean is the sinuses.
Yeah.
And so yes, if you have some conditions of the sinuses, that can also that could present as
right.
halitosis. Yes.
See them, or see any related professional, right? We don't solve these things over radio, though we do our best to explain, okay? So yes, you're looking for causes, but you're also asking about interventions or treatment and management of your halitosis, okay? You don't share with us whether you have related mental health issues, but hey, see a professional. That's what I'll say. This one says, sadly, Ghanaians keep... Oops. No. Let me go down. Oof. Good afternoon, Nortey. I think sometimes capping of the teeth that also causes that the smelly mouth odor, as under the teeth or the teeth rots underneath occasionally. Please correct me. This is Nana on Spintex. Capping of the teeth can cause the mouth odor.
Yeah. So so when he says capping, what he means is it's also known as putting a crown on the teeth, and when a crown is done properly, and when you are given the proper post-op instructions, when I say post-op, after the treatment, knowing how to care for your crown, what it takes to clean.
After sales servicing.
Exactly. And maintenance. So
maintenance.
When you have all that information, you shouldn't have that experience.
All right.
But if you do, then that means that something is lacking. It could be something that the individual is doing wrong.
Right.
So we talk about things like frequency of exposure to sugar or processed sugars.
Okay.
Or it could be in the design, but usually I think it's good to have that checked to find out.
Right. Same way some people don't look after their dentures well.
Precisely.
Yeah? Okay, and that could also cause problems, right? It doesn't mean dentures cause bad breath.
Yeah.
Right. Okay, great stuff. Now, a friend always uses hydrogen peroxide to wash her mouth. Is it the right thing to do if one wants to know? For a friend.
I think that hydrogen peroxide is not made to be used in the oral cavity routinely.
Okay.
So there are some times when it can be prescribed, but we don't want this being used as a routine and on an ongoing basis.
Okay, great. Afternoon, you insist on calling me naughty by nature. I am naughty by nature. The chewing part of my teeth is now sensitive sometimes. What can be the cause? Lastly, my teeth turn extremely white when I change the brush. Along the line, it changes color again. Note, I change brush every month. Should we be seeing this person?
So I think that firstly, the recommendation is to change your toothbrush approximately once every 3 months.
Okay.
So the fact that you are changing every month may mean that you are over brushing.
Okay.
And that would also cause the sensitivity on
right.
the chewing part of your mouth.
Mm.
The one thing that I would like to say is that the theme for World Oral Health Day, we actually already know. But one of the things that was really refreshing to actually see is that rather than focusing on the brushing 2 minutes twice a day, there was a real push this year to encourage people to look at flossing or cleaning in between their teeth.
In between the teeth.
Yes.
Right.
So we need to remember that if you're not brushing in between your teeth or using cleaning aids to clean in between your teeth, then you're missing as much as 30%
All right.
of the oral material that needs to be cleaned.
Okay.
And that may also be leading to the halitosis, bone loss, etc.
Okay.
So the real push for 2025 is also to go in between the teeth, rather than just your general
teeth.
cleaning.
And
Yes.
not leave out the tongue as well.
And not leave out the tongue.
Okay, assist me. What is the maximum teeth extraction one can have? I've done 2, and there's another bad one.
So
Is there a maximum
I don't know.
threshold?
I guess
I
it's 32.
yeah, exactly.
You could-
this is such a funny question to answer.
you could extract all of them. We
Right.
don't advise it. The whole aim is to keep your teeth as long as possible. We want your teeth to outlast you. So we need to really be looking at why you're having teeth taken out, and whether other options could be used to address what's going on.
Okay, I'm in a blitz because I'm trying to, we're out of time, but what causes a tooth to chip, especially the incisors from teeth, causes of clenching, grinding of teeth, and why does it mostly occur during sleep? All this is Dede in Maryland. The gap in between the front teeth, diastema, is it a misalignment of the teeth from birth, and can one develop it as one ages? Can you do that in a blitz?
You can definitely develop midline diastemas whilst you are aging. We need to look at the cultural aspect of that, because obviously in West Africa some people think of that as a beauty mark, rather than as malalignment. What was the other question?
What causes the front teeth to chip?
Causes of front teeth to chip, either trauma or the nocturnal grinding, as well as an erosive diet. So if you are doing lemon and water mouthwashes, if we're doing a lot of fizzy pop, etc., all of those are going to weaken the enamel. And then if you overlay any form of grinding or excessive use, or using your front teeth in the wrong manner, using it to bite your nails, cut sellotape, that will also lead to flaking of the enamel.
And harvesting ice cubes.
Yes.
As some people say, blogger. All right. Please, what's the difference between mouth odor and bad breath?
They are largely one and the
The same.
Uh-huh. All right. Nortey again, Prof. Texan's niece. What does she say? I'm trying to. Where are you? Good afternoon. I think. Oh, she asked the question about the capping of teeth. We've addressed that. Okay. I'm still trying to remember which niece this is. Right? I'll figure you out. Okay. So we've pretty much established, right? But I definitely have to yank you guys in, right, and do some cleaning and scraping of some of the issues. Okay. Definitely halitosis is a big issue. And people are now, talking about it. Some in, should I say, severe disturbance on account of this, right? And it's hindering their lives, their social interaction and all that, even occupationally and so on. So we'll have to beg you and have you back, right? You mentioned that one way to break the ice is a voucher of sorts. How do they come? Just quickly, if we can do that. How do they come, and are they in units? Do we call you or whatever and say, oh, it's like somebody buying you perfume. It's a gift, isn't it? Doesn't mean I'm buying you perfume because of X or Y. But how do we get a voucher? If I wanted to get a voucher for...
Oh, so you can actually just call our number and just speak with any of our people who are our client liaison officers and just let them know you are looking to buy a voucher, and they will now take you through the process. And we can actually arrange to have it delivered to you if you can't come by the practice yourself.
You're not going out to arrest the person. You're delivering the voucher. Please. All right. Great stuff. Let me tidy this up. The daughter who's grinding her teeth, especially in sleep, is 10 years old. All right. So, and we'll see how we can make those linkages with Platinum. We have other health or dental health professionals, right? So it's not about Platinum per se. It's about understanding the linkage between your oral health and your mental health. Happy mouth, happy mind. I saw something lovely on their Instagram. The staff of Platinum are dancing, and you actually have a song that goes with it. Yeah?
There's a song for the World Oral Health Day.
Oh, the song is for the World Oral Health.
Yes.
It's not a platinum song.
No.
Oh, we'll do our own.
Yeah.
Because I have a dance.
Oh, okay.
Yeah. Unless...
But there is a challenge, and so if you go onto our Instagram, there is a challenge, and I think the challenge is running for the whole month. So you have to learn the dance, you have to do it and video yourself and send it in.
And get...
And the GDA, Ghana Dental Associations, are the ones that are leading that challenge.
All right, so there's a challenge.
It's a whole national thing. You have to do it. It's loads of fun.
Yeah, my challenge is that we have to do one that gets Novishi to dance.
I agree with
All
you.
right?
I agree with
Otherwise, we'll diagnose. Okay. Please, at age 38, people chew teeth when at sleep. What causes this grinding and chewing and what is it?
So,
Is it the mattress? Quickly, what is it?
Parafunction, stress.
Yeah,
Okay.
you know.
Right.
Yeah, so.
Okie dokie. All right. Change of breath is mostly monthly. Is not a result of going hard on it. I use the tip of my fingers to brush. Brush is always in good shape. It's just a long time habit. That's the one changing. Can that still be an issue?
Well, if you are certain that you aren't exerting undue pressure when you brush, then possibly not. But my recommendation would be to see a clinician, because I've had patients where I've literally had to do what we call a dietary diary over a period of time, just to know exactly what they're eating, know what's going into their mouth, and then try and diagnose where the sensitivity could be coming from. So,
or you could just switch to an electric toothbrush.
Yeah.
So as guys are running this thing again on Instagram, which basically says that why do we all seem to be stuck with a Nokia 3310 when there's now iPhone Pro 16 Pro Max? So we need to be thinking about moving on to electric toothbrushes. And one of the advantage, those of you who are on camera, is that most electric toothbrushes will demonstrate when you are brushing too hard.
Okay.
So they'll light up red to inform you that you are putting too much pressure on your teeth.
Guess what? Last year you gave me an Abeku
yes.
electric toothbrushes. I traveled, and for the life of me, I couldn't find mine. And then just this morning, I was looking for something, and I said, "Hey, these people,
We'll ask.
they are doing African electronics. Somebody wants the contact. Let's end with that contact for Platinum."
The phone numbers is 0302 998 750, and the web address is platinum-dental.com.
Okay.
All our social media are Platinum Dental Services.
All right, it's been. I did tell you it'd be a mouth-watering discussion, but it's been quite a mouthful as well. Dr. Yao Asamoah-Adu, principal dentist, Platinum Orthodontics and Advanced Dentistry. Even their name is a mouthful. Abba. I need to floss after that. And then Dr. Novishi Akutu, she's the lead clinician and specialist or consultant orthodontist. She does all the alignment and vulcanizing to do with your teeth, misaligned, misshaped, and all those comininis. But we will definitely bring them back so that we look at, braces and all the other procedures that actually I think we should be concerned about now. Stick and stay on Joy 99.7 FM. It's been a mouth-watering edition and experience with Platinum. Right? I'll go back to Kwame Eugene. Tinefie. If you won't go with us to chill, Tinefie. Stick and stay.